emergency. So our objectives, California that has this emergency regulation to protect workers during this wildfire season, and because it's historic right now, we're really breaking records. Let's see if we needed something else, right? Identify the components of a training session while still complying with current COVID-19 CDC guidelines for social distancing, mask wearing, amongst other requirements such as respirators, right? Analyze if your company must comply with a requirement for an N95 respirator when the air quality index for PM 2.5 is less than 151. So PM 2.5 stands for particulate matter that it is under 2.5 diameter size or less. So that's what it means. But we're going to talk about some of the things that will bring compliance to your workplaces. So I've had several questions about this, and in the past, we never really paid attention to the wildfire smoke because we thought it's the firefighters who are dealing with this. Our prayers are out with them. I really, really feel for them and their families. I just cannot imagine what it is to be waiting for your dad, your uncle, your friend to come back every day from fighting fires. And people that have lost their lives and have lost everything they have. So this is terrible. This is sad. We've had record-breaking temperatures, heavy winds. What's next, right? What's next? So what we want is to stay strong. What we want is to continue to focus on our jobs. And as safety people, what a wonderful, noble job you're doing out there, right? So thank you. Thank you for listening to these talks. Thank you for bringing us information, for sending me your links, for telling me, hey, you might have spoken about this, what about that? And so thank you, we appreciate that. So let me take you directly to the relationship that the CDC is establishing between COVID and the wildfire season, because here in California, Oregon, and Washington, we are breaking records. We're having some of the largest fires in the history of our wildfire season. So it's awful. And this is what the CDC is saying, because some of the symptoms related to being exposed to the wildfire smoke are also symptoms that appear in the COVID-19 list. So let's review that link quickly. Let's go to that link. Try to share always all of my links with you guys so that we know what the research is saying here. So you can click it in Spanish. One of the things, I don't like reading this word by word, because you can read that on your own. But I like to highlight the things that sometimes go, oh, wow, okay, we should do that. And one of the things that you should do is prepare for wildfires before the wildfire season. We already know where the Santa Ana winds hit. We already know if we're in an area of work that brings every single year wildfires. And if you already know this, prepare beforehand. This should be something included in your emergency action plan, right? And right here, this CDC site is geared towards preparing families, the public in general. So take it read it with a very analytical view of, if you are preparing your work site for this, then you're going to take a look into, are your workers exposed outdoors or indoors, or both? And how do you protect those outdoors and how do you protect those indoors? Are you mandated, and how are you mandated to comply, right? So we're going to take a look at the regulation. Actions to protect yourself from wildfire smoke. Well, you have to look for clean places where the air is clean. Any other way, you try and put your air conditioning in your house, close all doors and windows and make sure that the air recirculates. That's for the public, because remember that is a totally different animal when you're talking about commercial buildings. And so that's why this 1 hour talk, it's important, so that we highlight those differences and we highlight the things that we need to do, right? Cloth masks do not protect you from wildfire smoke. Neither does the N95 really. Nevertheless, it's a layer of protection mandated at a certain level of particulate matter in the air. Why, if it doesn't really fully protect you? Because we're talking about a particulate filter, right? It's a mask that goes over your nose and mouth that stops some of the particulate matter in the air, because we have a lot of ashes in the air right now. And it doesn't protect firefighters, for example, or the people that are actually doing cleanup or fighting the fires, because wildfire smoke is not only particulate matter. is also gases, right? Carbon dioxide, carbon monoxide, and other gases in the mixture. So the actual protection that firefighters use is SCBA, a self-contained breathing apparatus. It's a different type of respirator that actually has an air tank, which supplies with pure air or clean air to the firefighter's face. So there's no filter associated with that. So as you can tell, lots of things that are important. We need to create a cleaner airspace at home or at our office to protect ourselves from wildfire smoke, right? So it says either if you use a portable air cleaner, and later on in this slideshow, I have an actual site for the California, because this is a federal website, a CDC, but we have a California site for California Clean Air that actually names brands of air cleaners that are approved for use to actually help you with the smoke during wildfire season. If you use a do-it-yourself box fan, and then you can click on that to see how that is all about, but that's not recommended for what? Industrial settings. This is for the public, so you can continue to view these things. But the reason why I opened this link is because this is good information for our workers, right? Also because we talk about symptom screening at work, and we have symptoms that are related to COVID-19 that are quite similar to symptoms of wildfire smoke exposure. Nevertheless, there are some that are different in that list, such as what? The diarrhea, the fever, chills, muscle or body aches, right? For those of you that were in this talk 2 weeks ago, we were discussing how in real life doctors in ICU COVID specific units were encountering COVID-19 patients. And they said that the main symptoms that they see are fever, sore throat, cough, chest pain, and muscle aches, and the difficulty breathing. The diarrhea and the other ones, the loss of taste and smell, those, although are part of the list, they're very rare. They're rarely encountered at the actual hospital. And that may be because those are either the people are not perceiving them, or milder onset of the disease, etc. Because remember, a lot of the times you can recover from COVID-19 at home because you don't develop a severe type, or you're not severely ill from it. But there are symptoms that kind of are the same. And what happens here is we have at work a screening procedure as part of your COVID-19 prevention program. And so before you admit people to work that day, you need to screen them, take their temperature, and they need to talk to you about symptoms. So if you're located in one of those areas where the wildfire smoke is quite dense, and we're going to talk about what that means, you know, when is it good air, when is it good air quality, when is it moderate, when is it unhealthy, very unhealthy, etc. You need to make sure that you discuss this with your people, because they need to know that sometimes you're not going to let them come to work if they have several of these symptoms, and that it really matters for them to be honest with themselves, because many times, you know, we deal with these issues where they just want to stay home, and that's why they're saying, you know, oh, I might have been exposed to somebody with COVID. I know some of you are getting these issues where, you know, this person just, you know, wants to stay at home for the weekend because Labor Day weekend. So I know where these requests are coming from. We all know that. So we ask for employees to be honest. Everybody knows their own body. Everybody knows underlying conditions and things that we've experienced in the past, or how often we get sick, that kind of thing, how healthy we are. So if they are having symptoms, it's better to be safe than sorry, you know, and send them back home, and after they've been screened, and make sure that they do the self-checker, or they go through their health provider to make sure that, what is this? Is this COVID-19 or is this smoke related, right? So that part is important to make that analysis. This other thing is very important to you, safety coordinator, and to you, manager, to you, foreman, because if you are in charge of crews that are out there, or you need to go to different locations, you're driving to different locations where their smoke is quite heavy, people are coughing, etc., you need to make sure that you know which population of your workers, which of your workers are in this list, either less than 18 years old, which I doubt. Very few of you are employing people between 16 and 18 with special permit and all of that. But a lot of you have adults aged 65 years and older. So there are an increased risk of harmful health effects from wildfire smoke. Pregnant women, People with chronic health conditions such as heart or lung disease, asthma, and diabetes. Outdoor workers, though, the people that are out there doing landscaping, installing floors, windows, plumbers, any of those people are doing renovations, any of those people that you're sending to do home health care, and you're sending them out to areas where the smoke is all, or areas where there might be an evacuation because of smoke or fire. People who have lower socioeconomic status, including individuals experiencing homelessness or those who have limited access to medical care. So that's something you don't really think about, but the top part of the list you do. People who are immunocompromised or taking drugs that suppress the immune system. And you discuss this with your workers during your tailgate meetings because they need to know whether or not they're at risk. A lot. We're going through a lot as a nation. So this is good that we're staying strong, that we keep our spirits up, that we tell our workers, I care about you. Even when you see this list, children less than 18 years old. So one more thing, all of your workers standing right there with you or working right next to you, next quote unquote, because 6 feet apart, right? They're all going through all of these things where they have children at home or children that, went to school, but now they're sent back to school because now they're all quarantined because there was one case of COVID at their school or whatever. And now you have wildfire smoke. So now it's another thing for them not to be able to go out and play. So less things for them to do, more of your workers pulling out their hair because it's so much on them. So when you discuss these things, you try to help them and you provide with resources and you say, hey, we printed some resources for you to help you and how to provide some activities, indoor activities for your kids and children. Although that's not work related, the fact that you provide with resources, approved resources by CDC or your local health department, and you put a notice there that is under their own risk, or you have like even, how do you call those documents that they sign when you say you're not responsible? Went out of my mind. But you do those things. There are extra things that you can do for your workers that tells them that you care, right? Because we're all going through this together. Note what you do if you must evacuate. So now it talks about evacuation. You must make sure that you put them waivers. That's the word I was looking for, waivers. So make sure that you have waivers in place whenever you need to, but do provide for things, okay? Oh, let's see. Pay attention to local guidance about updated plans. Stay informed where to find information about air quality and COVID-19 in your area, etc. So now let's get back to California and what California workers are experiencing here. Keep in mind that while social distancing guidelines are in place, finding cleaner air might be harder if public facilities such as libraries, community centers, shopping malls are closed or have limited capacity. So how does this translate at your place of employment? Social distancing is right now, at least you have practice right now on how to social distance your workers. But now on top of everything, if they are, so I have this one client where workers are going and installing, right? They're construction crews, they're installing different types of things. It could be windows, it could be floors. Okay, so whatever you're doing at that facility, if it's an apartment building, that's considered residential. If they're gonna be doing installation indoors, well, that's good. But because this is a residential building, you must make sure that you talk to them about, hey, you're in an area where wildfire smoke is within this range, good, moderate, not good, healthy, unhealthy, we're gonna get there. And we need you to close the doors and close the windows and make sure you set the AC in a recirculation mode, right? We're going to talk about it because you need to do a little bit of homework in this regard, the air quality indoors. You do need to do some homework. But the key point here, because we're talking about social distancing, is that if you're going to tell them, if you're going to be doing installation, make sure they close windows and doors and all of this, you also have to make sure that you don't have a lot of workers in one same spot indoors, right? So a lot of you, I know, but these are things that need to be taken care of. We need to really, really continue to do safety. That's your job as a safety person. Or if you're in charge of human resources, or if you have somebody else report to you all of these issues, you need to know where they're coming from. Cloth masks that are used to slow the spread of COVID-19 by blocking respiratory droplets offer little protection against wildfire smoke. Of course, because masks are being worn at work, not to protect you, and you know that now. Wearing mask, when you wear a mask, is not to protect yourself. It's actually to protect others from the spread of the disease. And they wear a mask to protect you, right? So that's the key there. Is one of the strong tools that we have. my goodness, I've seen a lot of information out there in the internet saying that masks don't work, blah, blah, blah. I understand. I understand. There's a lot of controversy, but the CDC does have some numbers that correlate statistically to the reduction of transmission of populations that wear masks prior to the wearing of the mask and then after the wearing of the mask. So I know there's other contributing factors. Nevertheless, right now at work, the policy is mask on so that everybody works together as a team to prevent the spread at work. While there are still respirator shortages in some sectors, California healthcare providers are no longer experiencing an extreme respirator shortage. And I checked this because this was an update made on the Cal OSHA page in August 6th. August 6th, yes. And it hasn't changed. So what it says is, although there is some shortage, there is no extreme respirator shortage anymore here in California because the manufacturers have increased their production, right? So as employers, please continue to make your efforts to obtain a sufficient supply of NIOSH certified. That means National Institute of Occupational Safety and Health is the actual agency that certifies respirators. They test them and they say this is good to filtrate particles, right? So continue to try and get them if you are one of those facilities that needs to comply with this emergency regulation, okay? So right now, what's happening right now is dozens of major wildfires burning throughout the U.S. and the West Coast, destroying hundreds of homes, more than 3 million acres here in California. 10 people died in the Butte County Sheriff's Office, which is what they're reporting. They're still locating missing people. About 64,000 people are under evacuation here in California. Firefighters are battling more than 29 major fires. You know all of this. You've seen the news. So we have all of these extreme heat and dry conditions. So make sure you're doing all of your heat illness prevention protocols. Make sure you have it in place. Some of you are working towards compliance. Some of you are working with me to have a program for heat illness that works for your facility. I find that the hardest thing with heat illness is getting your supervisors to buy into it, to know that they are responsible for checking the temperature of the day, each of the hot summer days, each of the days where the temperature is expected to be above 80 degrees. They need to know what's the highest temperature of the day and at what time. They need to know whether or not they have new workers in their crews that need to be acclimatized. They need to know what is a heat wave under the regulation, the definition of a heat wave under the regulation. Those are the things that I have the most difficulty with in the field. So the work safety in wildfire regions is not intended just for firefighters and cleanup crews only. This regulation is for all of those workers that are outdoor workers and even some indoor workers. We'll get into that, but some mainly outdoor workers in areas of work or that are sent to work in areas where the air quality is not very good. We're going to get into numbers. I'll get there. Power outages are also an issue when there's fires. And we know this because, you know, they have to cut the power because there's a fire. And now you have this issue where there's safety issues associated with power outages, such as what? The issue of not having emergency action plan. I made a mistake here. It's not relation to your current EPA, is your current EAP. EAP means Emergency Action Plan, right? Because EPA is Environmental Protection Agency. And what I meant to say here, power outages are also inside or written out in your Emergency Action Plan. What do you do in case of a power outage? And you also have a close relationship between power outages and the lockout tagout policies at your workplace, because when there's a power outage, if you have machinery and equipment working, you don't want to kill the power to some machines all of a sudden. So you have to have generators in place, and this analysis should have taken place during the implementation of bringing new equipment, etc. But workers also need to know there's an outage, they need to turn off and put the switch down and turn off the equipment so that when the power is restored, no one gets hurt. So all of that needs to be included in your emergency action plan and your lockout tagout policy. If you don't know what the heck lockout tagout is, that has to do with the servicing and maintenance of machinery and equipment and making sure that you Don't try to unjam a piece of equipment while it is moving and then you get an amputation or that kind. It's trying to prevent amputations at the workplace. But also when there's fires and there's power outages, there's the danger of people not knowing that if they don't remember to turn off machinery and equipment, they may restart all of this sudden, which is what the lockout target regulation tries to prevent. I'm trying to speak a little slower or clearer because my English sometimes gets really jumbled up, and because I get really excited and passionate about these topics. But I read your comments and I read your evaluations. I'm highly appreciative that you take the time to put your input, to give me your input, because it makes me strive to be better. And one of those things that someone mentioned is sometimes you go a mile a minute, and I cannot understand. That's a problem I've had for a long time. So trying to slow down and be a little bit more clear in what I'm speaking. Worker safety in wildfire regions. Well, now we have this regulation, which is an emergency regulation that came into being since last year, July 2019. So it's not new, but California saw the need for this because a lot of people were complaining and there's nothing in place to help us to be healthy, right? Especially people that are more sensitive or that have some respiratory underlying conditions like asthma, or they never knew that they could have an asthma attack because of wildfire smoke. And you know that asthma, sometimes people don't suffer from it, but they get sensitized to certain agents in the air, and all of a sudden they have an asthma attack. So all of these things came into being, and Cal OSHA said, because there is a standards board, and they prepared an emergency regulation, section 5141, to protect employees exposed to wildfire smoke. And the regulation requires all of this: identification of harmful exposures. When is it that the workers are actually exposed to harmful wildfire smoke? The communication, how are you going to communicate with them? What is the type of training and instruction you're going to provide to them? And how are you going to control these harmful exposures? And then there's specific particulate sampling requirements if an employer opts to monitor employee exposure with a direct reading instrument. But in order for you to have to follow these things on your screen, we need to know what's the scope of the regulation. For those of you in my bloodborne pathogen standard class this week, thank you, by the way, we had a very successful class. You knew how important it is to go back to the reg and see what the scope of the regulation is. So I'm gonna click on it, take you there. So that you see scope. So take a look at this, please, and carefully analyze this. This section applies to workplaces where, so you start thinking about your place of employment. A, the current air quality index, and I'm going to take you where you can see what the AQI is. For PM 2.5 is 151 or greater, regardless of the AQI for other pollutants. And B, the employer should reasonably anticipate that employees may be exposed to wildfire smoke. So if these two conditions meet, you fall within this regulation. You're like, oh boy. Okay, so now you need to know the air quality index at that area of work. So if you're sending people here, sending people there, to Santa Clara, to Newport Beach, all the way in Fresno, Tulare, and up north, or San Diego, or Laguna Beach, or Aliso Viejo, wherever you're sending them, you're checking the air quality index. And if it's PM 2.5, 151 or greater, and the employer reasonably anticipates that the employees may be exposed to wildfire smoke, boom, you're it. You have to comply with all of the components. If these two things do not meet, these two things are not met, then you don't have to comply with the whole thing. But I would still, because you know me, I'm always trying to help you bring this to the workplace in a way that workers stay safe. So I don't know if you've noticed, but even when the air quality index is less than 151, you still feel it in the back of your throat. Right here where we're at in Aliso Viejo, there's a dark cloud. We can't even see the sun for days. I'm sure it's the same for you. And there's ashes all over our black cars, especially if you have black paint. It's horrible. It's thick with ashes. So there's still, and there are some groups that are sensitive. There's still some of those things that you can do to talk to people and say, hey, let's hold a tailgate meeting. So tailgate meetings are required for construction crews. but they're not required for the rest of us. Nevertheless, all of you have your indoor illness prevention program where you have said that you communicate often with your workers about safety matters. This is one of the topics you should be discussing if you're one of those California places of employment where smoke is an issue, right? And right now it is. So that's why we're holding this topic today. The following workplaces and operations are exempt from this section, okay? So there's an exemption here. There is, and then here, has Oregon or Washington adopted a similar law, or is there something similar on the federal level? Remember that the federal government, OSHA, even if they don't have anything so specific such as this very specific section of the law, they will always go under the general duty clause, I'm sorry. And the general duty clause is what they will cite you under if you don't do anything to protect workers. So the answer to your question is, even if they don't have a specific regulation, no matter the state, because by the way, Oregon and Washington, along with California, are very strict in their policies. So if you have any establishments in Oregon, Washington, and here, put something in place. Put something in place. And if your headquarters is in California, trust me, we're the strictest. Just extend it to the Oregon and Washington establishments because it's still going to be covered under the general duty clause. Okay, but I still, if you want, I'll do more research later on to find out if they have something such as a an emergency regulation or something of that sort. But there is still a requirement to protect them under the general duty clause federally. Exempt from this section, enclosed buildings or structures in which the air is filtered. So here, filtered by a mechanical ventilation system, and the because not all mechanical ventilation systems have the appropriate filters, okay? And the employer ensures that windows, doors, bays, and other openings are kept closed to minimize contamination by outdoor or unfiltered air. And B, enclosed vehicles in which the air is filtered by a cabin air filter, and the employer ensures that windows, doors, and other openings are kept closed to minimize contamination by outdoor or unfiltered air. C, the employer demonstrated the concentration of particulate matter 2.5 in size in the air does not exceed a concentration that corresponds to a current AQI of 155 or greater. And it keeps on going according to Appendix A. And employees exposed to a current air quality index that's 151 or greater for a total of 1 hour or less during a shift, So for a total of 1 hour or less during a shift. So you kind of have to calculate how many times they go in and out of that building. If you have outdoor workers or home care workers where, you have to have them look for, like this would be for a census person. They go door to door into residential buildings. And so while they're inside the residence, if the residence has AC and the doors and windows are closed, while they're in there, they're okay. But how long of their shift do they spend outdoors? And if it's more than 1 hour, then you wouldn't be exempt. Firefighters engaged in wildland firefighting because they have their own regulation. For workplaces covered by this section, an employer that complies with this section will be considered compliant with these two sections for the limited purpose of exposures to a current AQI from wildfire smoke. So if you have to, for a workplace covered by this section, if you are compliant with 5141 and 5155, because remember 5141 has to do with respiratory protection, right? And now it goes into definitions, etc. It says you have to read it. You have to read it if you are within the scope of the regulation. So you have to read it, right? Because you need to learn how you need to comply. And then let me take you back to what we're doing here. California applies to most outdoor workplaces where the current air quality for airborne particulate matter. So I talked to you about this, where employers should reasonably anticipate, and this is key, where you reasonably anticipate that employees could be exposed to wildfire smoke, you start making inquiries as to what type of exposure that is. You need to know what are the health effects. This is part of the training that you do. Like we said in the beginning, the wildfire smoke is composed of harmful chemicals, tiny particles also suspending in the air. So it's not just particles, but it's also gases, and it presents a significant health hazard for workers exposed to it. Even more if they are within that list of the CDC for people with more risk to being affected by wildfire smoke, and even more so if they're working outdoors, right? These things could be the things that the fatal health effects that they could suffer from are things such as reduced lung function, bronchitis, worsening of asthma if they have asthma, and heart failure. So you comply with the regulation if both of the following conditions apply, which is exactly what I read in the regulation, right? If those two conditions apply, then you start looking at your landscape workers, you start looking at your construction workers, you start looking at those nurses or people that are out there and out there saying, such as those COVID-19 testing sites at parking lots, etc. Any other outdoor or indoor work where workers are anticipated to be exposed to wildfire smoke. We're going to talk about why indoor, right? So this is the part where there's an actual table where the current air quality index is divided into 6 categories. This is derived from federal regulation, which was copied into the emergency regulation. And it goes, and right there, so I like that I actually gave you an answer right there. There, in this slide, Melissa, you will have the actual chance to look for that regulation. This is the federal regulation, Part 50, Appendix G, Title 40 Code of Federal Regulations, which talks about air quality and the air quality index. So good research to do. Nevertheless, what I said before in regards to the general duty clause for all of those states in the nation that do not have a specific regulation for exposure to wildfire smoke would apply. So the categories are 0 to 50. And what is 0 to 50? We're talking about those particulate. So it's particulate matter in the air that is 2.5 microns in size or less. Because remember, we talked about the size of particulates or particles in the air anytime we're worried about where will they settle in the respiratory tract. The bigger the particle, the less chance of that particle being inhaled and going all the way down to the alveoli. And the alveoli is the little tiny ends where the exchange with oxygen and other gases that your body needs to survive and function happens. So it's at the very end of the function of your lungs, where these alveoli are performing the function of transferring that important substance, such as oxygen, into your bloodstream, right? So the smaller the size, the more it'll get there. So what you want is to avoid exposure to particulate or particles that are tinier than 2.5, right? So that's why this is measured that way. And the levels of health concern go from 0 to 50 is good, 51 to 100 moderate, 101 to 150 unhealthy for sensitive groups. And now you know what sensitive groups are, because we had a table of under 18 years of age, 65 and older, anybody with any respiratory conditions or underlying conditions, asthma, etc. Pregnant women. 151 to 200 is unhealthy. 201 to 300 is very unhealthy, and 301 to 500 is hazardous. So I'm going to take you to this link that I put here, super, super important link. This is the air monitoring by california.gov, Governor's Office of Emergency Services. And I love this table, okay? Because those of you doing training, even for those places of employment where you don't have to comply with the entire regulation, but you do want to do a tailgate meeting and talk to them about, hey, our area of work, there's a lot of smoke. We feel it in our throats. We know what it is. I want to talk to you about what OSHA says about the air quality in our region, and use this table along with the table in the regulation that I just showed you with the numbers. So good, 0 to 50 says air quality is satisfactory, poses little or no health risk. Moderate, that means the air quality is acceptable for most, and that's 51 to, what was it? Was it 100? There might be moderate health concerns for a small number of sensitive people. Unhealthy for sensitive groups, you go into increased likelihood of respiratory symptoms in sensitive individuals, aggravation of heart or lung diseases, and premature mortality in persons with cardiopulmonary disease and the elderly. Unhealthy, increased aggravation of heart or lung disease and premature mortality in persons with cardiopulmonary disease. So you can read the rest, but now I gave you an actual it gave an actual description associated with those numbers that I just gave you, right? Just so you know, anything in the purple and maroon, the very unhealthy and hazardous, is off the charts. You are required to provide with an N95, at least an N95 respirator for those workers that are exposed in these areas. But anything in the good or moderate, you're not required to provide a respirator at all. When you get to the unhealthy for sensitive groups, it could be respirators on, and when I'm talking about respirators, we're talking about N95s on a voluntary basis, right? There's a lot of good info on the Cal OSHA, because right now I'm talking about it, but then you want to kind of write it down, right? On healthy for sensitive groups, voluntary use. On healthy, so 151 and up, you start making an analysis, because anything beyond, let's see, let me take you to that table. So I don't want to speak here out of turn. This is all information that is very, very, very important. So from 151 to 200, when it's unhealthy, you do have this issue of providing the respirators on a voluntary basis, but anything above that, it's mandatory. So let's talk about how to take a look at the AQI forecasts. So check the EPA Air Now website for that purpose. That's what tells you for your city and for the region or the work sites where your workers are going to. It tells you the actual air quality index. That's what you want. You want to always monitor this. It's a little bit like the heat illness prevention, right? Where you want your supervisors to check and take a look at what's the high temperature of the day before the start of your shift. Same thing here. Make sure that they check it before. It tells me that you can't open it. Okay. Oh, can't open it. Okay, you can open it. Don't open it then. Let's see if this one will do it. Yeah, this one will do it. So there was a news release on October 27, 2019, and this is on the OSHA website. This is for information. So it's still posted up there because it applies to today. And right here, as you can see, is the actual Air Now website. And this is how you monitor the actual air quality of the region, the site, or the work site for your outdoor workers or indoor workers, because what if you are sending them back and forth, or they're basically just complaining when they get to the office, they feel raspy, they don't want to come to work, they're coughing, etc. You want to check the air quality right there in your city by zip code, city, or state. So let's say we put here 92656, which is my zip code, right? And then it says it's moderate. So now you know what that means. Now you know that it is okay, but when you get to the orange and the red, then any sensitive groups are going to be affected, right? So it's not good. It's moderate, right? So this also has an app, and you can go to Air Now on your smartphones and download it. So all supervisors and foremen should have this app right now during wildfire season. So that they can check what will be the quality of the air in their areas for sure. purpleair.com for checking the air. No, I'm not familiar with the purpleair.com for checking air. I only went into a couple of the ones that Cal OSHA promotes, and this is one of them. But I will check it out afterwards. So as soon as we're done, if you guys hang around for a couple minutes, we'll go to it. So thank you for giving me that information. So once you checked and have an idea of what's happening in that area of work, and you have that number, now you can make a little bit more of a determination as what you need to do with your workers, right? To give you more information as to, you could do it through the EPA Air Now website, which we just did, or you could do it through, so it's either 1, 2, or 3. It's one of the 3, because you could also use an actual measurement device. That's number 3, right? Requirements for communication. So if both of those conditions apply, and your quality of air in the areas of work for your outdoor workers is 151 or more, and you anticipate them having to be exposed to wildfire smoke, then you're going to have to communicate with them and tell them, okay, for this area, this is the AQI, this is the air quality index. What are the protective measures? Well, the protective measures that we're going to put in place for your safety are, and then you start telling them, we're going to ask you to stay indoors for this much time of the day, or during this 5 days that we're having raging fires in this area and the wildfire smoke is so thick and dense and it's above 151, we are going to suspend work, or we are going to have you only work from home, or you actually tell them and delineate what are the protective measures that you're taking in order to prevent or reduce the exposure to the wildfire smoke. You're going to encourage employees to inform you of what if the air quality is worse. It could be because they're telling you or because they're checking on their own. And any adverse symptoms that may be the result of wildfire smoke exposure, such as asthma attacks, difficulty breathing, chest pain, that could happen. Remember, every single one of your workers is different. Everybody reacts differently. That's why with the issue of a vaccine, we were talking about how everybody will respond differently and those trials need to take place because everybody's different. The human body acts differently. We're all sensitive in different ways. Same thing here. You have to tell, hey, tell me if the air quality is worse in your area. And I also need to know if any of your guys has symptoms. When both of the previous conditions apply for, meaning 151 or more, right? And when we're talking about 151, we're talking about the air quality index for PM2. PM2, you already know that is particulate matter that is of a size of 2.5 or less, it's in the air in a concentration of 151 or more, then that would mean you have to also give them Appendix B of the regulation. And what is Appendix B of the regulation? Well, you're going to be surprised. It's kind of like your policy made available to you. I love it that at least they did this. So OSHA said, hey, first thing, let's tell them about the health effects of wildfire smoke. So it gives you everything about the health effects of wildfire smoke. And then the second one is the right to obtain medical treatment without fear of reprisal. C, how employees can obtain the air quality index. And we already did it through one site, but then you guys are pitching in some other sites. Awesome. As far as, and it even tells you here, another website, www.enviroflash.info. So more information there. D, the requirements about wildfire smoke, such as what? Number one, you check the AQI before and periodically during each shift. Number two, provide training to employees. Number three, lower employee exposures. Number four, provide respirators and encourage their use. And so when you start having this Appendix B, this Appendix B that I'm showing you right now is mandated per the regulation if the air quality in your places of employment or where you're sending your workers to do work, outdoors, or even indoors, but outdoors, it's 151 or greater, right? And you anticipate that they will be exposed to wildfire smoke. So you have to do all of this, right? And two-way communication system, methods to protect employees from wildfire smoke, locating work in enclosed structures, changing procedures such as moving workers to a place with lower AQI, reducing work time in areas with unfiltered air, increasing rest time and frequency, reducing the, so they give you examples. And anything else that you want to write, you just put it in writing. You can convert this document into a Word document and draft your policy from here. So isn't this important? Important limitations and benefits of using a respirator when exposed to wildfire smoke. Respirators are an effective way to protect employee health, right? When the current AQI for PM 2.5 is 151 or greater, employers shall provide their workers with proper respirators for voluntary use. Okay, so 51 or greater, voluntary use. If it's greater than 500, then it's mandatory, required. So that's key. I want to highlight this so that there's no confusion, because a little bit before in another slide, I kind of went like, wait a minute, right here is voluntary, right here is required. Here it is, no more confusion. When the current air quality index for PM 2.5 is 151 or greater, you provide them on a voluntary use. If the current AQI is greater than 500, it is mandatory, right? And then you have to make sure that you have them. If it's mandatory, it has to be under a proper respiratory protection program, etc. The following precaution, a respirator should be properly kept clean. The following precautions shall be taken. Select the respirator, so it goes into more of the nitty gritty of Appendix B requirements. And then it goes into making sure you talk to them that scarves and t-shirts, bandanas does not provide protection against wildfire smoke. And it does say a respirator N95 does provide minimal level of protection for wildfire smoke. Why? Because we said it is a particulate filter, right? then how to properly put on, use, maintain the respirator. So even if you do it on a voluntary use, the difference between a voluntary use and mandatory use of a respirator is that when you say, you know, we're at 151 or greater, we must make sure that you guys have instructions on how to wear a respirator, because man, you see people wearing respirators out there in the funniest ways, you know, upside down with the actual metal piece right down here, or the straps all bundled together in a bow, you name it. So you need to tell them how to wear them, right? And no, I've never seen anybody with a bow. But what I mean is they really do wear these things in a very funny way. So you want to make sure you tell them how to wear it. You want to make sure you tell them about their limitations. But when it is in a voluntary basis, you as an employer, you do not have the requirement to send them to have a medical evaluation prior to the use, which it is mandated when you have the respiratory protection plan in program, the program in place. And annual fit testing is also required for those that mandate respirators. Okay, cool. Very nice. We kind of went over that. You see how much we have to share many times? It's crazy. So, okay, so this is exactly what I said, the voluntary use versus the higher than 500, right? Where can employers obtain N95 masks? So we said we're not in an extreme shortage right now for healthcare, so you must still make an effort. And so I put a link here for you guys because, what did I put here? Oh, the interesting thing about this is that it doesn't tell you, it takes you to this link. This specific link was, it's in the Cal OSHA page, but it doesn't tell you how to obtain respirators. This is what I would say to you. Just talk to your regular suppliers. They do have certain protocols. If they know that you have wildfire smoke exposure, they'll be able to tell you how much of the respirators they can provide to you, okay? If not, you can call this link, and there's a phone number for air quality, and they'll tell you what to do. Let me see, why am I not able to go back to my, okay. Protecting indoor workplaces. So for indoor, it's a different animal, because the first thing that we have to do is, you know, ensure ventilation systems are properly maintained and functioning before the start of the wildfire season. That's just preparation. Or before the start of the shift for those going into other residential buildings. So if your guys are working installing windows, and the window already, floors, and the floors are already in an area where the residential building has a way for you to put the AC on, recirculate, and close everything else while they're installing whatever they're installing, hey, you can protect them that way. But you need to make sure that they have, see, what happens is if you send them to work in those conditions, you still have to check what's the air quality outside, because they're going to be going back and forth, you know, bringing materials into the buildings. And so remember, if it adds up to more than 1 hour during their shift, now you just bought the whole regulation. You have to follow all of the bullet points that we had in this slide before. During wildfires, areas affected with smoke are encouraged to set air conditioners in homes and vehicles to recirculation mode, but it's different for commercial buildings. So let me take you there so that you have good information in this regard. It's Cal OSHA talks about using the HVAC system to protect building occupants from wildfire smoke. And this part of it here is, you know, super, super important. I'm highlighting it for you because it says building operators should consider installation of the highest efficiency filters that do not exceed the static pressure limits of the HVAC system. So you basically talk to the person in charge of your HVAC system. So it's a specialist, it's someone that knows the design or understands it, right? And I know, Lindsay, if you can help me with the questions that they have, that would be great. Because someone raised their hand.
Alex raised his hand. I'm going to unmute you, Alex, if you had a question.
Please, go ahead.
Okay, it doesn't look like I'm able to unmute him, so please use the chat box. There is a question, I think it was a couple minutes ago. Are you familiar with purpleair.com for checking air?
Yes, so what I said is I haven't checked it out. I haven't actually clicked on it or gone to it. So after we finish at 12 o'clock, I'll go into it for everybody to see. I mainly stay within what the links in the Cal OSHA site are, and that's what I showed during during this presentation. But go ahead, Alex, and type up your question. We couldn't unmute you. Nevertheless, what I'm talking about right now is making sure that for those of you in buildings where your workers are working in offices or commercial buildings in areas where there's heavy wildfire smoke. And when we say heavy, we're talking about that 155, 151 and more, right? 151 and more. Then you're talking about talking to the person that is in charge of the maintenance and the proper function of your HVAC system, because they know what is the design of the system, how is it that it works properly. For example, this calls my attention because I'm no expert in air systems, right? It says pressure gauges should be installed across the filter. So the filter is a very, very important thing to indicate when the filter needs replacing, especially in very smoky or dusty areas. Indoor contaminants can be further reduced by using a standalone high efficiency particulate air HEPA air cleaner inside the building. The California Air Resources Board provides information on air cleaners. Unfortunately, when I clicked on this link, it doesn't take you there. It doesn't. So let me just click on it. Page not found. So leave it to Cal OSHA not to update their own links, but I did find it for you, and I have it on another slide. So listen to what it says. California Air Resources Board staff has advised that most HVAC systems should be able to accommodate a pleated medium efficiency filter with particle removal ratings of MERB 6 to 11, and some may be able to use filters with ratings, blah, blah, blah. So that gets a little too technical, right? All that I want you to know is that when you take this information in consideration and you present it to your specialist, the person that is actually maintaining your HVAC system, they know that you're doing your research, and you say, you know what? So I know that depending on the system that we have, we need to check that our filters are working appropriately. Consider a low pressure HEPA filter if the building occupants have respiratory or heart disease condition, or if the building experiences frequent wildfire episodes. So I like this information because even for us that are not air quality and HVAC specialists, we can bring this info and ask our specialist or the person providing the actual maintenance on our HVAC system to say, hey, so what is the kind of HEPA filter we're using? Because guess what? I do have a couple people sitting in A and B and C offices who have had heart conditions, or who came to me and they have had some sort of asthma attacks in the past, and they're worried. And although we have this filtered air inside and they feel that they're okay working here, we do have these concerns. And can we have this type of filter installed in our system? You see how this is good information? And so methods to protect, in addition to assessing and, if necessary, modifying the function of your HVAC system. So listen to this. Cal OSHA is saying, assess it. Assess how your HVAC system is actually working, and maybe modify the function to, because maybe you do have people that are in the sensitive group list. Employers are encouraged to take other reasonable steps to reduce employee exposure to smoke, including alternative work assignments, relocation, telecommuting, etc. And those are what? Administrative controls. Okay, so let me take you back to where I was so that I can share with you that link. And now I do have that question, right? Another issue is that when you make the HVAC system better for preventing smoke coming into the building, maybe that is worth for preventing COVID-19, since you want more outside air in. Correct. That's right. So that's why it's a touchy issue, because commercial buildings, you cannot, with commercial buildings, with non-residential buildings, you cannot just plainly say what they're saying to the public. Hey, just stay indoors in your house and set your AC to recirculating mode. You cannot say that in commercial buildings, precisely for what you're saying, especially if it's a COVID-19 specific unit at an ICU or a unit or a hospital. There's a lot into the designing of the room and negative pressure room and the positive pressure that you would create by recirculating air that would not be efficient in protecting worker, because recirculating air also increases humidity. So lots of issues. So you want to make sure that you're consulting with your HVAC specialist, and bring them in, bring your air specialist in to review what you have, especially during wildfire. But that's why we said in one of the slides, prepare for wildfire seasons prior to the start of the season so that you can have these issues resolved and you can either upgrade your system or do an actual analysis as to how you can modify it and do it the right way, right? Because that is not my area of expertise. There's a lot going into it. This class is focusing on giving you the tools to know, where you must be careful and what you can and cannot do. Protecting indoor workplaces from wildfire smoke with building ventilation system, more methods. Sure, qualified technician inspects the HVAC system. So I just said that. Smoke, some buildings rely on open windows, doors, and vents for outdoor air. Some may have mechanical ventilation systems that lack a functioning filtration system. That's key, because then you don't remove airborne particles, right? So that's why you bring the specialist in, because sometimes if you don't have a filter, you cannot reduce and you cannot have good indoor air quality, right? Air cleaners here, I found it for you. So there it is, the actual link. And now you have a link to what are the air cleaners that the California Certified Air Cleaner Devices or Resources Board, I'm sorry, the California Air Resources Board is approving for use. So there you go. So if you are bringing that into your clinics or any of your areas of work or at home, these are the ones that are approved. All right, let's see. What else do we have here? Did we fulfill our objectives? Oh, what do you know? We right on time. I'm open to questions. We did list the requirements for this emergency regulation because it does impose requirements on the employers who fulfill those two requirements. If the area of work for your workers is at 150 air quality index of for the PM 2.5, if you want to be super technical and mention the whole thing, but you could just say, hey, if my workers are going where the air quality is 151 and above, and I know I'm anticipating they're going to be working and exposed to this wildfire while they go from the building to the car and visiting this client and doing this and doing that, then I have to really make an analysis, because then I might have to fulfill all of the requirements of the regulation, right? Unless you can reduce that exposure to less than 1 hour. That would be fulfilling one of the exceptions, right? Number 2, identify the components of a training session. So first you have to give them the actual health list of health effects. And then you have to actually go through all of the Appendix B of the regulation. And so I told you where to find it, right? And then taking into account the social distancing, the mask wearing, and other requirements for the CDC recommendations, which I gave you guys some examples. If you're going to ask them to go and rest or take go into vehicles, now you have the issue of how many people in the same vehicle or how many people inside a building or a small room. And number 3, analyze if your company must comply with the requirement for an N95 respirator. So we clarified that. We said 151 and above, voluntary basis, 500 and more required, right? And we also talked about making sure that we know that respirators do not completely protect you against wildfire smoke, because this smoke is composed by gases and particulate matter. So it is only going to protect you to a minimum standard. So any more questions? I am open to them. It is 12 o'clock. Let me take you to that site that you guys told me about, purpleair.com. So let's see. Let's share here. Purpleair.com. Any questions, anybody? Real-time air quality monitoring. So who are these people? Anytime I give you sites, like yesterday I had a question by one of you in regards to statistics for the dentistry. And so I did have a slide that was by the CDC and it said 1%. And then I did a little bit more research and the actual link that I send you, or anytime I give you a link, I kind of always want to see who are the people putting out the link, because many times you find information that is not very reliable. So the information I sent yesterday, Lindsay, on that last link for the bloodborne pathogens, it's through a trusted service for journals and peer-reviewed literature. So, but it is always important to find good links. Purple air and COVID-19, how are we protecting you and our workers' health? So I love this. Map, shop, support, register, contact us. Who are they? Yeah, I bet they're getting a lot of emails. Purple Air site, home, map. I wanted to see an about us, Purple Air LLC. They're in Utah. View the map, real time. So I didn't see this actual site on the OSHA regulation, but anything that you can use. Wow. So it does give you those numbers real time, and then it gives you the numbers on a map. Oh, so it's really cool. Any other, can I ask, why did you suggest this site? Have you been finding good information that you have translated into training for your workers? But there it is. There's the site that you wanted more info on. Like I said, I always, and this is for all of us, always make sure that you provide information to your workers that you can verify that is a trusted source. All right, guys. Great talking to you today. Lots of information, I know. I am actually sending and providing my my clients with things like this, like training sheets, and I translated the whole thing too. OSHA has some of this information translated, but then when you put together a training or a training sheet or a handout, you cannot put all of the stuff that we showed today in the class. So I went ahead and prepared this one, and I will let you guys have it, okay? So this one, as you review it, you'll see that it has a synopsis of what we talked about today, and I have the translation. So I'll also make it available to all of you. I'm really, really grateful for your time. Talk to you soon. See you next week. Oh, real quick, remember next week we have a hazard communication class. It is the last day, today and Monday, to come on board. Make sure that those people in charge of chemicals at your facilities sign up for the class. It's going to be a very in-depth class. They're actually going to become the trainers for your facility. Although we're not certifying them as trainers, after they take this class, and they do get an actual certificate, right, Lindsay, when they take the 8-hour class?
Yes, they will for the CEUs and credits.
For their credits and everything. Still, when they get that much information, they remember OSHA does not require a certain for different things. OSHA does not require specific documentation as to what type of certification did they receive to be in charge of the training. They just need to be people with the training and the experience. So if they take this 8-hour class, trust me, you will be able to assign them and designate them as the person in charge of your hazard communication program. And that's super important because remember, it's the second most cited regulation in the nation. So OSHA knows that they're going to find a lot of violations there, and is the 5th most cited violation here in California. So make sure you come on board. Today and Monday is the last time to sign up for it. It's 2 days, 4 hours each day. It's very in-depth. And please, if you're going to be in the class, start sending me emails about chemicals that you are handling at the workplace, because we can highlight some of the issues that are happening, where the violations are for that particular chemical, or the things that you do with it. Thank you. Thank you, Steve, and thank you, everyone. Have a great day. Fantastic weekend. Enjoy. Stay safe. Stay safe. And thank you. Thank you for what you do. Thank you, Lindsay.
Yes, thank you, Alba. Thank you, everyone. Have a great weekend.
Thank you.
Thank you, Jen. And Steve has the last question, so let me answer that one, Lindsay.
Okay.
Yes, Steve. If a respirator is mandated, so if the air quality index is above 500 and you mandate it, then respiratory protection program is required, and then you're required to do the actual initial medical evaluation and then the annual fit testing. So absolutely. Thank you, guys. Thank you. I heard about purple air. They'll come from hikers, backpackers to focus better. Okay, great. That's good info. Thank you, guys. Have a great day.
Everyone.